what are CLL signs and symptoms?
This is a very elusive disease. I mean that the vast majority of patients are not diagnosed because they have symptoms. The most frequent case is that they are performing tests for other comorbidities, like annual regular checkup, and we identify an increased white blood cell count. And then when we characterize the reason for this increase, the clonal leukemic population emerges and we can diagnose the occurrence of CLL. So this is usually an asymptomatic disease at the time of diagnosis. And it's one of the rare blood disorders in which we can get the diagnosis without invasive tests like bone marrow biopsy or aspirate, because the characteristic of the leukemic cells are so distinctive in the peripheral blood that it takes only blood sampling to identify the presence of CLL. Then, if and when the disease progresses, patient can develop symptoms. The symptoms in the vast majority of cases are related to the occurrence of anemia or thrombocytopenia, but mostly anemia. The patient can complain about fatigue, and they can develop fatigue while they are doing daily life activities or specific exercises, but this is not something the patients are complaining about the diagnosis. In general, there are no disease-related manifestations. Rarely the patient report the canonic symptoms that are in general associated with lymphoproliferative disorders like low-grade fever, weight loss, and drenching night sweats. These are only reported in a minority of patients, and again, not a diagnosis, but usually at the time of progression, they can be associated with other signs or symptoms of disease progression. And again, at the time of progression, the patient may develop enlarged lymph nodes, and they can be detectable by physical exam or by imaging tests like abdominal ultrasound.
So a lot of times, there are no signs or symptoms. Many times CLL is detected incidentally. You go to your doctor for your routine labs, and all of a sudden you see that some of your white count is a little bit higher than what it used to be. And not uncommonly, you go back, and they actually been higher and higher and higher for a few years. So in the great majority of times, that's how it happens. Your primary doctor or another doctor is doing labs for something, find out that your counts are a little bit off, send you to a hematologist, a blood specialist to evaluate it. But sometimes the disease can be what brings the patient to the doctor. So CLL might have been going on for a little while, and you may have some low counts, some anemia, so maybe you're more tired than usual. The disease can be very active, and you've been having sweats or losing weight, or the lymph nodes are too big and start bothering you, and that brings you to the doctor. So there are different ways that the disease will present. In the great majority of times, no symptoms whatsoever. It's just really a lab abnormality. And sometimes it will be really the issues that will cause more problems and then bring you to the doctor attention.
When we see patients with CLL, we categorize them whether or not they need treatment. The treatment is based on established criteria by the International Workshop of Chronic Lymphocytic Leukemia, or IWCLL. These are established criteria that will indicate when patients require treatment. But basically, it is a matter of symptoms or problems that the uncontrolled proliferation of these cells is causing, such as anemia, low platelets, or issues with autoimmune thrombocytopenia or anemia, or organ getting too enlarged, causing problems. And on a rare occasion, these lymphocytes can actually transform to a more aggressive state, what we call Richter's transformation, and this is a more type of an aggressive lymphoma at that time, where the prognosis is less favorable. They will start getting, bruising, weight loss. They can start noticing lumps. They can start having anemia and therefore fatigue, which is very prevalent. They can start having, bleeding issues because the platelets are low, and the white count can be very high, even in the over 100,000. It's not uncommon.